Good morning, good afternoon, good evening to you all. Great to have you all joining us today on Global Handwashing Day. I'm Ann Thomas. I'm Senior Wash Advisor at UNICEF HQ, and I lead the Sanitation, Hygiene, and Institutional Wash team in New York. On behalf of WHO and UNICEF, we are welcoming you to this special event commemorating both Global Handwashing Day and also the launch of the global guidelines on hand hygiene in community settings. Today is not just another date on the calendar, but a powerful reminder that hand washing saves lives in every community. It's also a moment to reaffirm that ensuring access to hand hygiene is not a one-off event and not an individual responsibility alone. It's about our public policy, infrastructure, and investment. And the launch of these guidelines is the result of years of work, and it was all catalyzed during COVID-19, where the world was reminded of the central role that hand washing plays in protecting health, where countries everywhere were working to scale up hand washing stations and to promote hand washing behavior change. But what also became clear was that we needed a more long-term approach. We needed a stronger evidence-based international guidance to help shape national policies, to set standards, and sustain action beyond a pandemic or disease outbreak. In response to this member state demand for this guidance, the guideline development process was launched in 2021 under the banner of the Hand Hygiene for All initiative. For the first time, these guidelines translate the global evidence on hand hygiene into recommendations that governments, local authorities, and partners can adopt to promote hand hygiene practice. This milestone was made possible through the collaboration of experts, governments, civil society, and communities across the globe. And we want to thank everyone who contributed their time, expertise, and passion to bring these guidelines to life. We have an exciting session lined up today, including a presentation of the key recommendations that are contained within these guidelines, insights from champion countries and partners on how they're putting this into play, and opportunities to hear your questions and reflections. Thanks once again for being with us, and I'd like to pass over now to Joanna Estevez-Mills from the WHO to walk us through the guidelines.
Thanks, Anne, and hi everybody, and happy Global Handwashing Day. There's a little bit of background noise, so if you could mute your mics, that would be greatly appreciated, and I'll get started. I hope you can see my screen. So yeah, thank you, Anne, for that introduction. What I want to do today, I've got 10 minutes to present on these guidelines to just provide a few minutes worth of context. And I'm sure all of you will be aware of the information I'm going to present in the context, but I think these are important messages that do bear emphasizing on a day like today. Then I'm going to go through the guidelines themselves, as Anne said, the key recommendations within, and reflect a little bit on implementation and next steps. So in terms of context, why hand hygiene now, and why the guidelines? Well, we know that hand hygiene is life-saving. I don't need to say this, but really it is staggering that hundreds of thousands of lives every year are still lost to infections that could have been prevented by hand hygiene. And if you don't know about the reports that are on the screen, I would encourage you to look at those for advocacy efforts. Also, hand hygiene is incredibly cost-effective as a public health measure, and one report a few years ago placed domestic hand hygiene on a par with oral rehydration therapy. We know that there is global commitment to enabling hand hygiene, so the importance of hand hygiene to human development, but also to emergency response and to health emergency preparedness is internationally recognized. And yet, we also know that progress continues to lag, and the most recent report launched just a few months ago, or just last month, showed that in 2024, 1.7 billion people still lacked access to a basic hand washing facility in their homes. And we know that the most of the burden really falls on the shoulders of those who need it most. Nearly half of those people lived in sub-Saharan Africa, for example. And we know that rates of progress need to double globally in order for us to meet our 2030 targets, and that rates of progress would need to increase by 11-fold in least developed countries and 8-fold in fragile contexts to reach that global goal. We also know that guidance on how to accelerate hand hygiene access and practice has really to date been quite unclear and lacking. So in 2021, when we started this process, we carried out a scoping review of existing global guidance on hand hygiene. And whilst we did find 923 recommendations across 51 international guidelines, it was striking the level of discordance across these guidelines and this guidance, and also the number of gaps that we were able to uncover, and also that fewer than 10% of recommendations were evidence-based. So really that's the background for these guidelines that we're launching today. The next few slides go through what the guidelines recommend and what the basis for these recommendations is. And you can access the guidelines. You should be able to access them now online using that QR code that's on the screen. So quickly, just on the focus of the guidelines, I do want to emphasize that we're talking here today about hand hygiene in community settings, which really the quickest way of describing that is settings, any setting for which healthcare is not the primary goal, healthcare delivery. And so we're talking here about households, public spaces, and institutional settings like childcare centres, schools, workplaces. And also we're talking about a number of different areas for hand hygiene. And I think the easiest way of describing this is on the right-hand side of the screen, looking at this in terms of a theory of change. So if we want to achieve effective hand hygiene at the top there, we know that there are certain minimum material requirements that need to be in place. And we also know that there is an important behavior change component as well to sustaining the practice. And our perspective and our focus for these guidelines is really on understanding what government measures need to be implemented to enable effective service delivery that can deliver the minimum requirements and the behaviour change needed. So these were the topics that we wanted to cover in our guidelines. And what we did in terms of process, this slide really just goes through in one slide 4 years of process. So do bear with me. But essentially, the basis for these recommendations and for the guidance that you'll find in this document is independent expertise and opinion, and those two things have come together to enable us to provide this guidance. In terms of the evidence base, I have just provided a QR code here to date of supplement on BMJ Global Health that you should be able to access there. Just for lack of time, I can't go into any more on the process, but if you have any questions, please do post them in the chat. So moving now to the outline of the guidelines and the content that you'll find within them. Like I said, we're focused on community settings, and I've also presented on this theory of change already. What's a little bit different that you can see here is we're looking at improved health outcomes as being our outcome of interest, sustained practice of effective hand hygiene as being the output that we want to achieve. And we know that there are certain core requirements for hand hygiene that need to be in place to enable the practice of effective hand hygiene to be sustained over time and for that habit formation to occur. And in terms of the government measures that we talked about earlier, we know that it's important for there to be a systems-based approach to this rather than short-term project-based approaches that have potentially been the overwhelming approach up until now. So looking at the column where the blue column, recommendations or guidance. So the guidelines provide 3 recommendations, which we'll cover in more detail in the next few slides. And also they provide they provide implementation guidance on how governments can implement these recommendations. So let's take a closer look at this. Recommendation 1. So governments should implement policy, legal, regulatory and fiscal measures to promote hand hygiene as a critical public health intervention. And these actions for promotion should aim to remove barriers to the practice of hand hygiene and strengthen the factors that enable behaviour change and sustain practice. That is our first recommendation, really making sure that we're getting the basics right and that we're emphasising the responsibility, the importance of hand hygiene as a public health measure, the responsibility of governments for ensuring that everyone everywhere is able to practice this important protective measure, And thirdly, describing and defining what we mean when we talk about promotion, and it not just being about messaging, but it also being about ensuring that people have access to the basic requirements and that those barriers are removed. You can see in the guidelines document that recommendation 1, is covered in chapter 2. In the blue box here, the recommendation is repeated, but I just want to show that also I want to flag to you that in the guidelines, you can find much more detail on how it is that we arrived at these recommendations, and much more information that can support your advocacy efforts in country as well. So remarks around it being an important public health measure and providing a real evidence base for that claim, remarks around the normative aspects of government responsibility and how it is that we lay this responsibility at the foot of governments, and then in terms of promotion as well, remarks that really emphasize the different aspects of promotion. So moving to recommendation 2, hand hygiene should be practiced with plain soap and water for enough time to enable covering both hands entirely with soap and thoroughly rubbing at key times when disease can be transmitted via hands. And those key times are before preparing food, before eating or feeding or breastfeeding others, after using the toilet or handling feces, after coughing, sneezing or nose blowing, and when hands are visibly dirty. And also, alcohol-based hand rub is an effective alternative when hands are not visibly dirty. Now, a lot of those things might be things that you would potentially take for granted and think that were already there in the guidance before, and you would be right. But what the guidelines do as well in this chapter 3 is to identify other aspects of hand hygiene materials that we knew there were certain question marks around in the literature or in existing guidance. And so you can see here at the bottom under remarks that we not only recommend plain soap and water or alcohol-based hand rub as an alternative, we also provide guidance on the water quality required, the types of soap that should be used, alternatives to soap and water, and also things that shouldn't be used, and recommendations and guidance on things to avoid, and also on hand drying methods. And just to flag here as well, we do have some visuals within the guidelines that might useful for this as well. So here on the materials and technique at the top, and the key times for hand washing and hand hygiene at the bottom. So moving to recommendation 3, this recommendation covers the core requirements for changing and or sustaining the practice. So access to minimum material needs as the first one. The second one, access to information on why, when, how and where to clean hands. And thirdly, a conducive physical and social environment. And then the next 2 slides will unpack this a little bit more as well. So you can find information on this recommendation on core requirements in chapter 4. And again, to flag that the recommendation itself is quite pared back, but there are several remarks within the chapter that provide further detail on what those minimum material needs are, the information and the conducive environment. And you can see that reflected here in this diagram, where we have these 3 core requirements all centering on sustained hand hygiene and enabling it. When it comes to minimum material needs, the guidelines provide guidance per hand hygiene event, so really providing as much guidance as possible on the quantities of materials required per hand hygiene event, but also providing guidance on the requirements per hand hygiene facility. So what needs to be in place? What is the specification for hand hygiene facilities that enables equitable and sustainable access to the materials? And we're talking here about reliability of water supply, availability of soap, accessibility and affordability, any adaptations to reduce contamination points, and also theft resilient design. When it comes to information, our second core requirement, yes, we're talking about getting the basics right, really enabling hand hygiene, just providing basic health promotion information that enables it by talking about why to wash hands, when and how, but also moving from enabling hand hygiene to motivating it. So health promotion information that goes beyond the basics to encourage and motivate hand hygiene. And the third requirement around the conducive environment. And just to flag, there is a physical aspect here, but we're moving beyond just the material needs for hand hygiene towards kind of the convenience, the attractiveness, and the ease of use of these materials, which we know from the evidence can really drive the behavior. And then looking at the social environment as well. So here, essentially talking about social norms through role modeling, positive reinforcement, routines, and community engagement, and a lot more detail in the guidance, which I would encourage you to explore. The final piece of the guidelines, which is not a recommendation per se, but it's really the implementation guidance that we provide, really focuses on the role of government, like I said, emphasizes the importance of taking a systems approach. And sort of, I suppose, top line takeaways are that government should provide oversight and coordination to ensure the complementary components of a system and that they function effectively together. Local government is responsible for ensuring equitable and sustained access to services, and national government is responsible for developing policy, normative and legal frameworks, as well as institutional arrangements. And this is all covered in Chapter 5 of the guidelines, where we really provide three main things. First, a framework to help us understand when we talk about a system and a hand hygiene system, what do we mean, and how can we provide a clear framework for people to engage with. Secondly, looking at system actors, so actors that have a responsibility or a role to play within that system, and really outlining those roles and responsibilities for much better clarity and accountability. And the third point we handle is around integration of hand hygiene within related policy areas. So we did find it necessary to elevate the importance of hand hygiene and to shine a spotlight on it by producing these very specific hand hygiene in community settings guidelines. But when it comes to implementation guidance, the importance of integration really can't be overstated, and understanding how we can integrate these recommendations into broader areas of work that are ongoing and funded. And here, I'm sure this is a lot more detail than you need right now, but it's just to flag that we do have some useful visualizations of the system and also of these roles and responsibilities across different levels of government and the services as well, that I hope you can take a more detailed look at. And just to end here, one more minute really, to flag that yes, today we're launching the to be doing that, but we know that guidelines on a shelf are not going to be that useful during the development process, engaging a number of champion countries and governments who've been interested to join us along this journey, who've helped us design that implementation guidance that I just presented, and who will be with us now to start piloting and working in countries to see how this guidance can be adapted and implemented at the country level. So I'll just stop there and hand back to you, Lindsay. Thanks so much.
Thanks so much, Jo. There are some questions in the chat that we should address before we open up to our panelists to clarify some questions on what the guidelines are. Thank you to our hero, David, who has shared the correct link in the chat. So you can go ahead and download that, and we'll update the link in the presentation here. So, Jo, there's questions on whether the guidelines are designed for urban settings versus rural settings. For example, in rural contexts, ash is commonly used as an alternative to soap. Can you clarify whether this practice is considered acceptable?
Thanks, Lindsay. Do you want me to take them as individually?
Go with that one, and then I'll grab one or two more for you.
Yeah, okay. Thanks very much for that question. Yeah, the guidelines are relevant and applicable to urban and rural settings. This is outlined very clearly in the introduction so that it's clear what the relevance is. And in fact, they're also relevant for stable development contexts as well as emergency contexts too. In terms of the question on alternatives to soap and water, and in particular ash, what our guideline development group discussed was on the aspects around sort of the health benefits and whether or not ash was effective at removing pathogens from hands. The evidence on this question is actually not as substantial as you might hope. And so it's difficult to make a fully evidence-based decision on this. But what we also what the guideline development group also took into account was questions of equity as well, and discrimination around recommending ash. So in the guidelines, the conclusion for this was that we do not recommend the use of ash for hand washing. We do recommend that the basics of water and soap should be available. Where they're not available, we would say that as a last resort, ash would be an acceptable alternative. But I think the devil is in the detail and in the nuance, really. So not recommending it as something that people should rely on, really pushing governments to think about ensuring there is access to these basic requirements, water and soap, but understanding that in contexts where that is not available, ash may well need to be used as an alternative.
Great, thanks, Joe. Two short questions here before we close up and pass on to Bruce for our panel. One is the question of whether or not the guidelines involve the role of the private sector. And the second is whether or not gender, equity, diversity, social inclusion is addressed in the guidelines.
Great. Yeah, so the question on private sector involvement, yeah, absolutely. And you should hopefully see this in the chapter that handles implementation guidance, where we talk about the different roles and responsibilities within this system. So we definitely put the emphasis on government responsibility, on overall government responsibility for delivering the basic needs for hand hygiene. But that's not to say that governments are responsible for the nuts and bolts of delivery and for direct delivery of services. The role that we place at the foot of government is to ensure that overall oversight of a well-functioning system, and to ensure that roles and responsibilities are clearly outlined, including the role of the private sector, and that private sector actors are enabled and regulated in an appropriate way. That would be the role of government. In terms of the role of private sector, as it's outlined in the guidelines, you'll see that we acknowledge a number of different service providers, including customer service providers, but also public service providers. And you'll see that in the customer service provision, there is an outline of the role of the private sector in supporting the rollout of these recommendations. I think there was another question, Lindsay.
We're talking about gender, equity, diversity, social inclusion. If you can just give a quick thought on that.
Yeah. Oh, just to say on that point, we have made an effort to focus on this. It's obviously an incredibly important issue. It's one of our guiding principles for the guidelines, which you'll see right at the top of the document, and it's something that you will see reflected throughout the document where relevant, to emphasize, be it in the core requirements section or in the implementation guidance section.
Fantastic. Well, thank you so much, Joe, for the presentation. And you can see now you can access those in the link that was dropped in the chat. And we'll now pass over to Bruce Gordon, who's going to facilitate our first of two panels. Over to you, Bruce.
Wow, thanks so much, Lindsay, and thanks, Joe, for giving us that overview. So now, yeah, we're going to return to the experiences of what Anne has called champion countries, and they are indeed champion countries, and we're happy to have some of them with us today. So this is going to be a panel format, and I'd like to introduce representatives from Mali, Bangladesh, Ghana, and Zambia. And maybe I'll do it all at once. So first of all, I have the pleasure of introducing Musa Hama, who I've worked with, is a really wonderful Deputy Director of the Hygiene and Public Sanitation Division of the General Directorate of Health in Mali. So Musa, I don't know if you could turn on your camera so everyone can see you. And then we have Mr. Safur Rahman, who is the Superintending Engineer, Department of Public Health Engineering, Bangladesh. So you're also welcome to turn on your camera if you're comfortable doing that. We have Kweku Kwanza. I believe I saw you earlier, so nice to see you, Kweku. And Chaleka Kazia. Sorry, Kweku is from the Ministry of Sanitation and Water Resources, Ghana. And then we have Chaleka Kazia. She's the Assistant Director and IPC Mentor, Ministry of Health, Zambia. So I have a question. It's the same question for all of you. And then if we have time, we'll have a second round. So the question is simple, and I'd like to begin with Musa. So simply tell us how you will use these guidelines in your country, so in Mali. So merci, Mr. Musa.
Merci beaucoup, Brice. Bonjour à tous et bonne journée d'abord internationale. Au Mali, je pense que nous avons plusieurs opportunités en fait d'utilisation de cette directive. D'abord, ce que nous comptons faire en fait, c'est d'utiliser cette directive comme étant un guide d'orientation stratégique et opérationnel pour renforcer en fait les politiques existantes déjà en matière de santé, d'hygiène et d'assainissement au niveau du pays. Et pour arriver à ça, nous comptons nous appuyer sur 4 points essentiellement. D'abord, l'intégration des recommandations des directives dans les différents cadres stratégiques nationaux, notamment la politique nationale de la santé qui doit commencer à être révisée dans les jours à venir. Voilà, elle a été élaborée dans les années 90 et nous nous préparons à la réviser. Donc, c'est une opportunité pour nous pour essayer de voir comment intégrer ces nouvelles directives. Et il y a également la politique nationale d'assainissement qui est en cours de révision aussi. Et aussi utiliser les différents canaux d'approvisionnement en fait en eau au niveau des institutions, notamment les centres de santé et les écoles. Ensuite, il y a un point par rapport à la mobilisation des ressources endogènes et exogènes, publiques d'abord. Voilà, parce que ça ne peut pas aller sans ressources financières. Et pour cela, nous donnons la priorité d'abord à un budget, au budget national d'abord, en essayant de mobiliser, comme je l'ai dit, les ressources financières endogènes et exogènes d'abord publiques. Et ensuite, s'appuyer aussi sur les ressources au niveau communautaire, parce que le Mali a un système de santé qui est décentralisé et les communautés ont en charge leur santé. Donc, il y a aussi une mobilisation financière aussi à trouver à ce niveau et aussi s'appuyer sur le secteur privé, parce que tout ce qui est intrant par rapport au lavage des mains relève beaucoup plus du secteur privé. Donc, il y a aussi, c'est aussi un pilier sur lequel nous comptons nous appuyer dans ce sens. Le deuxième point, c'est par rapport à la mise à jour, si je peux dire, des différents outils et documents standards nationaux pour prendre en compte les éléments des directives. Il y a beaucoup d'outils déjà qui existent parce que nous sommes dans le cadre de la célébration de la journée sur l'hygiène des mains depuis des années déjà, un peu avant que la journée ne soit internationale, on avait déjà commencé au Mali. Donc, il faudra revoir un peu les documents qui existent pour pouvoir les réviser et intégrer cette directive. Et il y a également le renforcement des capacités des différents acteurs à tous les niveaux à travers la mise à disposition d'outils pratiques qui soient adaptés au contexte national. Et le dernier point que je voulais évoquer, c'est beaucoup plus l'engagement communautaire à travers les leaders communautaires. Vous savez, la santé communautaire au Mali est en pleine expansion. Et nous comptons pleinement nous appuyer sur ce développement de la santé communautaire aujourd'hui au Mali, où on a déjà plus de 5000 agents, par exemple, de santé communautaire, plus de 10 000 relais communautaires qui sont déjà en contact direct avec les ménages, les écoles et les différents lieux publics. Et nous pensons que c'est aussi une manière pour nous d'utiliser ces directives. Donc, en gros...
Hey, Musa, sorry,
Oui?
can I just interrupt? Thank you so much. I know there has been a slight complexity with the interpretation, and I'm just hopefully people have found the right channel now. But I got a lot of it, and I wanted to thank you for highlighting the issues of building capacity, community engagement, and updating the standards. I might come back to you, Musa, but very much thanks, and I hope everyone that's listening is in the right language right now, because there was some mix-up on the channels. So now I have the pleasure to ask the same question to my colleague, Mr. Rahman. So I hope you can hear me okay. And the question is, yes, how are you going to use these in Bangladesh? And thanks so much for being with us.
Thank you. Thank you very much.
Muchas gracias
For inviting us
por
and
habernos
arranging
invitado.
such a good event for the launching
Y
of the
es un
guidelines.
muy buen evento.
You know, I mean, this is, I think, a $1 million question.
Creo que
which
esta es
is
una
very
pregunta muy
difficult to answer right now,
interesante. Es muy difícil de
But I see
responder
some
ahora, pero
potential,
veo potencial
for this guideline to
para estas
streamline
directrices,
with our documents.
para agilizar estos documentos. El gobierno de Bangladesh ha formulado
Hand Hygiene for All roadmap in 2024.
una hoja de ruta para el lavado de manos y veamos
that roadmap following the new things that is stipulated in this guideline.
que se estipula en estas directrices y comprender que las directrices son directrices. Ustedes saben.
Work unless we prepare a plan. You know, if I take the instance for water quality guideline of WHO, what happens? Every country, they are supposed to formulate their own standard first, you know, and then they are following that standard. Maybe in future, we will be able to formulate some standard for this hand hygiene, especially for the community setting. And right now, we are trying to achieve our goals of HDD, you know, first water, then sanitation, then hygiene. Maybe government, if it is communicated to the government, like, I mean, we don't have central government, it is only one government, it's the government. If it is communicated to the government through the local UNICEF or WHO office, then it might be embedded in our national documents, because I see there are very good recommendations from this guideline, and we will be able to formulate our own standard to follow this guideline. Yeah, if the government agrees. That's, you know, we from the department, we work for the government, and Department of Public Health Engineering works for water and sanitation all over the country. I should convey the greetings from the department as well as from the government of Bangladesh to all the participants of this event. But let's see what we can do. I mean, I cannot in one go, I cannot answer that what we can do with this guideline. But there are potentials of this guideline to be incorporated in our different documentation. Thank you very much.
Thank you. And I think you said it very rightly. I mean, at the end of the day, you know, these are a reference point for governments to consider. They're advisory in nature, and I think it's up to every government, like you rightly put it, with the WHO drinking water quality guidelines. It may find some adaptation into standards, but it also just might be, as I said, a reference. So let's see how we go here, but we'll continue to, I think, really benefit from the experiences in Bangladesh and other countries. So with that, I would like to ask the same question to Mr. Kwanzaa. Thank you for waiting patiently. And I think, like all the other participants, dealing with a little bit of interpretation issues, but hopefully that's all solved now. So over to you in Ghana.
Thank you, Bruce, and greetings from Ghana. As you might be aware, Ghana from 2021 till 2023, we have done a number of studies and assessments in hand hygiene, and what it came to the fact that we've, as a country, been able to develop hand hygiene strategy and guidelines and the minimum standards. And we did a lot of local content. So as a country, I think the international guidelines will help us to have further evidence for advocacy. Hand hygiene has not been well prioritized as a country, and we feel there is a very great opportunity for us to bring on board some international experiences to help build a case of evidence to be able to look for more funding and also for prioritization in implementing these beautiful guidelines that we have developed. I'm yet to get into the proper guidelines to have the details, but with the little that was presented, I mean, we are in a position to even pull some number of resources from the various international experiences to Ghana to use as a case studies to push for more prioritization, especially at the local authority level where hand hygiene are supposed to be implemented to the letter. Thank you very much, Bruce, and for the opportunity to share from Ghana.
Thank you, Kweku, and also to all your colleagues in Ghana for doing such tremendous work. And I think, as you said, and a lot of the panelists have mentioned, this happens at the community level or in settings, right? And so I think that's a huge part of the I guess challenge is to make sure that we are able to have impact there. So thanks again for that. And I see our colleague Chelaka from Zambia. I hope your connection's okay. Are you able to hear me?
Able to hear you.
Perfect.
I'm able to hear you.
Wonderful.
Yes.
Okay. Well, thank you for being with us. And again, you know, Zambia is such a leader as well. We'd like to understand how you will try to use these in your country. Over.
Thank you. For Zambia, when we reviewed the guidelines as a WASH team, we indeed resolved that the guidelines will be adapted, disseminated and used by government to promote hand hygiene in communities. And this will be a very important reference document to provide strategic direction for promotion of best hand hygiene practices in communities. We also looked at the component of coordination. We thought these guidelines could also be, very useful for interministerial efforts and other stakeholders in terms of coordination. And also capacity building on hand hygiene. The document has brought out very useful information, especially on some of the core requirements of hand hygiene, and also the why, the when, and the how. We've done well maybe in the why and the when, but on the technique, we've lagged behind so much. So we thought that this would be a very useful document, even as we facilitate our hand hygiene in communities. And the document will also be very useful in facilitating system change in terms of infrastructure development, because it has given a lot of alternative and options when it comes to the hand hygiene infrastructure. I'm coming from the Ministry of Health, so I wouldn't even leave infection prevention and control in communities behind. We know that this hand hygiene is very, very important, usually as a public health measure, and a key standard precaution in infection prevention and control, which should not only be prioritized during outbreaks, but we are saying before, during, and even after the outbreaks. When we looked further at the guidelines, we said, I think, because we know that these guidelines are not meant for the healthcare facilities, but for communities, and also times when we have outbreaks, we can equally use them for public health emergencies like pandemics and epidemics. There's a section in the guidelines which has just outlined this and also talked about the type of hand washing devices which should be primed during the epidemics. This is also a very useful document which can be used for resource allocation and mobilization because it has itemized very important core requirements, like even offered guidance on minimum material needs, such as soap, water, and also alcohol-based hand rub. Again, like one of the earlier speakers indicated, very important document on community engagement in planning, designing, and implementation of hand hygiene programs. We were just chatting with someone before the presentation that, you know, in the communities, there's what we call the force field analysis, which is the first technology or methodology which is used to instill or to promote change in WASH. We say that this also could be made reference to where we have like the communities would indicate where they are in the area of hand hygiene and where they want to be. Where they want to be, they will need resources. So some of the resources are already outlined in this important document. And we are also saying as Zambia that this will be a very important document for system strengthening of hand hygiene interventions and also integration in ongoing community approaches, policies, and also strategies. We have several community approaches like the FAST methodology and also the community-led total sanitation and other, you know, WASH policies and other important documents. Thank you.
Wow, thank you so much. Thank you for bringing up IPC. It's interesting because some of the panelists are coming from ministries of health and some are coming from more from a water and sanitation angle, but I think it's time for all of us to work together to reduce infections. So we're running a bit late on time. I have my second question. What I'd like to do is ask for everyone's discipline in maybe just having a less than 1 minute response to my question. So we're going to test our interpretation channels and we're going to ask Musa. So Musa, if you're still with us, what is the one, if you could just think of one opportunity do you see for integrating the guidelines into other areas of health? Like what's your big sort of priority right now for making that a reality in Mali? So very quickly, if you don't mind.
Merci beaucoup, Brice. Je pense que l'hygiène des mains, comme c'est un peu transversal, nous pensons prioritairement à un certain nombre de programmes qui existent. D'abord, le programme de nutrition. Il y a une stratégie qui existe déjà au Mali qu'on appelle Wash in It, qui prend en compte déjà une bonne partie du wash. Donc, c'est une stratégie ou un programme sur lequel nous comptons nous appuyer compte tenu de l'importance de l'hygiène des mains dans la prévention de tout ce qui est maladie diarrhéique. Vous avez les programmes de vaccination qui sont les plus nombreux au Mali et les plus proches des communautés. Donc, sur lesquels aussi nous voyons une opportunité d'appui pour essayer de mettre en œuvre cette directive. Il y a la santé maternelle et néonatale. Il y a aussi il y a un plan déjà qui avait été élaboré dans ce domaine qui prend en compte quelques éléments en lien avec le WASH. Donc, nous comptons aussi nous appuyer sur ça. Et enfin, l'autre point, c'est par rapport à la prévention et au contrôle des infections de manière générale, essentiellement au niveau des établissements de santé. Maintenant, pour que cela devienne vraiment une réalité, donc il va falloir qu'on puisse avoir au niveau international, mais aussi national, des planifications conjointes pour qu'on puisse tenir compte de l'hygiène des mains en termes de budget déjà alloué à ces programmes-là, et de manière à pouvoir avoir un budget qui soit spécifiquement dédié à l'hygiène des mains. Il y a le renforcement aussi des capacités aussi des acteurs communautaires du domaine de la santé aussi, qui est une opportunité aussi pour qu'ils puissent vraiment comprendre quels peuvent être les bénéfices de l'hygiène des mains pour leurs différents programmes au niveau des communautés. Il y a aussi la coordination intersectorielle. Ce matin, nous avons lancé cette journée dans une école publique avant d'arriver à ce webinaire. Et nous pensons qu'une intégration des différents secteurs, notamment la santé, l'eau, l'éducation et aussi l'environnement, aussi peut être une possibilité pour nous de pouvoir intégrer ces directives. Et enfin, comme je l'avais dit dans le premier point, valoriser un peu la santé communautaire qui est en pleine expansion au Mali, s'appuyer sur les différents acteurs de la santé communautaire. Merci beaucoup.
Okay. No, thank you so much, Musa. And I think this point you make about joint planning, but a standalone budget is very important and is one of my takeaways. So now back to Mr. Rahman. So Bangladesh, yes, one of the first champion countries. And I'd like you to just briefly comment on how this could potentially influence the implementation of hand hygiene across divisions and districts.
Yeah, thank you very much again. Actually, as I told you, in Bangladesh, the Ministry of Local Government, Rural Development and Cooperatives is the apex ministry for water supply, sanitation and hygiene. You know, we have one national forum for water supply and sanitation, which is chaired by the secretary. If this guidelines comes to that forum, down to that forum, we have Watson Committee in division, we have Watson Committee in district, sub-district, and even in the unions. So the message can go to the rural areas even, down to the lowest administrative boundary, so that they can be guided during the project implementation linked with water and sanitation, and can improve their hand hygiene situation in their own area. Yeah, there is an opportunity which can be utilized through the government, especially the National Forum for Water Supply and Sanitation. Thank you very much.
Thank you again. That's really great additional insights. So back to you, Kweku. I have quite a specific question for you. So how will the Ministry of Water and Sanitation, which recently launched the new water policy 2024, work with the Ministry of Health to implement the guidelines?
I mean,
thank you very much once again.
Sorry.
In Ghana,
it's not for me.
If you can answer it too. No, just kidding.
Okay.
All right. So in Ghana, the policy rule in hand hygiene resides in three main ministries: Ministry of Local Government, Ministry of Water Resources, and Ministry of Health. So to be able to have a better coordination, we have a number of coordination platforms where we meet to discuss policy and implementation arrangements. And one of them is a Water and Sanitation Sector Working Group, where Ministry of Health, Ministry of Education, and all other relevant agencies come around for us to have discussions for the way forward. The second coordination point is the National Technical Working Group on Sanitation, where Ministry of Health is well represented. And this arrangement has been in existence for over 12 years. And here we always look at the implementation challenges and bring it up to the policy level. Another is another platform that we meet often is the water, sanitation, and hygiene in emergencies, which also coordinates a lot of issues on hand hygiene and water issues in emergencies. So all this pulled together, the water policy that was launched last year seemed to bring all partners together and share rules, basically to know who we did a lot of consultation from the grassroots. So the rules are clear, and also to be able to augment the way we implement our hand hygiene strategies. We have also brought on board other key partners who produce water at both the urban and the rural.
Waco, it may just be me, but I feel like we have a bit of a network issue.
Where we always send a lot of direction to our various operational level. And this arrangement has been one of the long-standing arrangements we have in Ghana. And though the hand hygiene sector doesn't reside within the Ministry of Health, we still have a very good rapport through this arrangement that I've mentioned. Similarly, Ministry of Health has some arrangement where we also sit and share ideas and provide some inputs into some of the
Okay, I think maybe we've have a difficult connection, but I think Kweku, you were wrapping up. So for this issue, I think you mentioned it, coordination platforms, policies, working with partners, that's all incredibly important. It's actually quite a complicated tapestry that you're putting together there, but I think it's actually needed for an issue like this. So thank you for relaying those experiences from Ghana and actually letting us know how do we work on an issue that sometimes falls in the cracks. So my last question, so thank you very much. My last question is to Chaleka, and it's considering the Zambian experience, and just in a minute, because we're over time, how would these guidelines influence or complement the hand hygiene roadmap? So over to you.
Thank you so much. This is a copy of the National Hand Hygiene Roadmap, which we've just launched today. I should indicate that the Global Hand Hygiene Guidelines provide a strong technical foundation that complements and reinforces the National Hand Hygiene Roadmap. The guidelines also offer practical insights and global best practices that can strengthen implementation, monitoring, and sustainability efforts, complementing the National Hand Hygiene Roadmap. When you look at also the guidelines and also the National Hand Hygiene Roadmap, you find that the guidelines help standardize approaches and set clear benchmarks for hygiene facilities, behavior change, institutional accountability across sectors, complementing the hand hygiene roadmap. Even the emphasis on evidence-based planning and monitoring is critical in strengthening data systems and use of evidence in decision-making, something which has really been brought out, in the guidelines. I think there's a lot of work which went in the guidelines, I should indicate, like even the evidence for using plain soap, which I will not elaborate further because of time, and also the use of ash, with the question which was earlier on asked. So this is a very important document, I should indicate. The guidelines are very important, and we hope as Zambia to adapt them. I submit. Thank you.
Well, thank you very much. I want to thank all of you, like not just your individual insights, which I think everyone benefited from, but just the engagement of your countries. So thanks to your colleagues as well. So big round of applause virtually for the panel. And right now I'd like to now go to the subsequent panel. So now we have a panel I'm really actually quite excited about, with partners that are supporting this particular area of work. And I'd like to, just in the same sort of fashion, invite Natalie Schmitz, who's a WASH advisor at GIZ, Alexandra Machado, who's the Water and Climate Lead from IFRC, and Prasad Gautam, who is our hygiene lead. I said our hygiene lead, but the hygiene lead for WaterAid. So welcome, everyone. I hope you've been enjoying everything so far, and we've got through some of the interpretation issues, and maybe this will be a bit smoother. So my first question is to you, Natalie, and it's about the guidelines and their kind of relationship or the influence they might have on schools. What does it mean for schools? So how do they complement guidance that is used for schools on hand washing?
Yeah, hi everybody, and thanks, Bruce. Yeah, so what the guidelines mean for us in a way. So at GIZ, we work closely with governments and often with ministries of education to support them in implementing their Wash in Schools programming. And these new global hand hygiene guidelines, they sort of help to fill a long-standing gap, which there's always been some challenges because they provide very practical parameters that schools and governments can then use for planning and budgeting. For example, I think this has been mentioned before that they very much specify the exact amount of soap needed per hand washing event, or also the recommended amount of water per hand washing event, and so that really that schools can budget and yearly plan how much soap do they actually need based on how much kids they have. But then also the recommended amount of water that is needed, so that informs also the the necessary infrastructure. But also I think especially when you look at the amount of water, really also showcases the need also for water saving hand washing facilities in a way that which is really helpful for schools. And then that if the schools can budget, then also the national governments and the ministries can really budget very well the overall amount of soap needed. And what we also really appreciate is that it gives very much clear guidance on how to dry hands safely. So I think schools, they typically do not have budgets to provide paper towels, and then it really also clearly says, okay, shared towels are not hygienic. So we very much appreciate that there's now guidance that also says, okay, shaking them dry by air is the best solution, and I think this is also a very feasible solution for many schools. And I think same with the hand washing behavior, that children and so on should not wash in the same basin of water, which is, I think, in a lot of instances still the case. So I think the guidelines will very much help governments to inform their own implementing guidelines, which ministries of education, for example, release for schools, and then that gives them also clear guidance and evidence to use exactly for their own implementing guidelines. Thanks.
Well, thanks, Natalie, and thanks to GIZ for all their work in schools and WASH in schools, including with the H, which we're talking about today. So your additional insights are really appreciated. So now over to Alex from IFRC, also a dear colleague. And I wanted to ask you, Alex, given that IFRC works in humanitarian context, can you tell us a bit about the challenges in implementing hand hygiene programs in those countries where you work?
Yeah, thanks so much, Bruce. And I think across the Federation network, as you know, we are 191 national societies. So we work daily in places where clean water and soap cannot be taken for granted. So many times infrastructure has been damaged or is non-existent, right? I like your question because I would like to share as well some key challenge from our national society and volunteers that face in implementing hand hygiene programs and how they are overcoming them, no? Because many of these challenges you have outlined it already in the guidelines recommendations. So for us as well, it's very clear. I will summarize at least, for me, yeah, as I say, the most basic challenge is the access to water and supplies like soaps, and where disrupted systems are is worse, because as we know, emergency and protracted crisis disrupt all these wash infrastructures and supply chains, right? So to address this, our national society, as auxiliary to national governments, they try to fill the gaps when needed with emergency teams and volunteers that we train to run hygiene and health campaigns. And we have sometimes equipment preposition, such as soap, hygiene kits, and hand washing facilities. But, we heard this is not only on emergency. We want to clearly look at the nexus and look not only on emergency crisis. So because our volunteers are part of the communities and they are before, and I like when Zambia was saying, we are before, during, and after emergencies there. They are active as well in many different crises, from flooding, disease outbreaks like cholera and Ebola, or they are working as well in IDP camps and people that are moved. No, so I think it's important as well to look for low cost solutions as well in this type of places, right, and not where we cannot really get a big investment in SDG 6, right, or money for that. For me, the second challenge as well is the culture and behavior, and I think we cover with different countries. You know, you can build 100 hand washing stations as well, but if people don't trust the messenger, they won't use them, or they will not change the behavior. And this is where our community volunteers become as well critical. I think they are not outsider delivering lectures, they are part of the community. And I think using strong community engagement and accountability approaches is key. And I like how we approach that as well, because our volunteer listen first, then co-create locally relevant message, and that resonate as well with the community, right? It's not coming. So I like the guideline, how it's as well this approaching that, because I think it's important that we address taboos, dynamics, belief, and ensuring that hand washing becomes an habit and not like we are creating the habit, right? And the last is funding. As I think we covered already, we all know these patterns. Funding for hygiene promotion surge always during cholera outbreaks or pandemics like COVID, but then evaporates when the headlines fade. Yeah, and sustain this progress, I think we are trying with our national societies, supporting government, making sure that hand hygiene is integrated into the broader programs, right? Health security, epidemics preparedness, and the climate adaptation as well, right? It's like it's not a standalone program, because perhaps we will not raise funds for that, and this is for us very important. So yes, the challenge is immense, but I think we have already achieved a lot as our work continues. I only wanted to figure that during the COVID-19 response, I think only with Red Cross and Red Crescent volunteers, we established over 215 community hand washing facilities worldwide. So this is quite a lot. When supply chains were collapsing, they as well were producing soaps and hand sanitizers locally. And only to say, we have something that will make all our work stronger. And the new WHO UNICEF hand hygiene guideline gives us a common language and standard for our collective work. And we fully endorse this guideline, and we commit as well to align this with our work in wash and health programs. So I hope we can make universal hand hygiene a reality in every humanitarian crisis, and thanks for all the work that you are doing.
Well, thanks for your work and everyone's work. I mean, we say WHO, UNICEF guidelines, it's all our guidelines. It incorporates everyone's experiences. And I think it has always been our, worry about trying to make sure that we can sustain hand washing after, emergency, budgets after emergency concern. That's why I think we're all here, because we see an opportunity to embed it into more of a development context, that nexus you talked about. So very excited about working with you on that. Now, turning to you, you've been personally and institutionally with WaterAid a champion of this for such a long time. We've been learning so much from you over the years. But I did want to ask you, how will these guidelines affect WaterAid's technical support to countries?
Thank you very much, Bruce. Thanks for the excellent question, and good morning, good afternoon, and good evening to everyone. Very thrilled to be in this panel, Bruce. First of all, happy Global Handwashing Day to everyone. Just to let you know that hand hygiene is an integral component of our work at WaterAid, and we have been providing programmatic and technical support to government all across 26 countries in Asia and Africa. And our hygiene work reached more than 30 million people in communities and more than 240 million people through our hygiene response to public health emergencies. So we have been also influencing for policy change, such as providing technical support to develop regional strategies and hand hygiene roadmaps in many countries, as we have also supported together for many countries, Bruce. As we have been providing technical support to government on modeling evidence-based proof of concept hygiene intervention in the countries, having these guidelines will further help to standardize hand hygiene program, strengthen capacity building initiative, nurture system-focused intervention, and influence government to establish more transformative hygiene behavior change program at scale in communities. WaterAid has been a part of this journey to develop these guidelines, and we strongly believe that having this standard guideline will help all technical actors, including WaterAid, into the sector to provide consistent and very standardized technical support to government. And as WaterAid, we technically support government on many aspects. For a couple of examples that I would like to cite here. First of all, we help standardizing hand hygiene program focusing on behavior-centric approach. So these guidelines also talks about considering more cognitive, environmental, social, cultural, and psychological factors during designing hand hygiene programs. So clearly realigns what we do, but helps to standardize. We support government on promoting evidence-based and scalable model. So these guidelines includes evidence-based recommendation for hand hygiene standards and also principle, and these are going to be fundamentally important to strengthen the program. We support government on strengthening capacity building efforts, and we are supporting government on integrating hand hygiene in broader public health programs and health system, whether this is immunization or nutrition or maternal health and so forth. In some cases, we are also facilitating costed planning in some countries. Example, Zambia just launched their guide, and WaterAid has been part of this, similar to Ethiopia and other countries. And we have been also influencing financing for hand hygiene into the sector. So we strongly believe that having these guidelines will further strengthen our ongoing efforts on hand hygiene in all of these areas that I have mentioned. But at the same time, it will also help standardizing similar effort by all key actors into the countries. As WaterAid, we firmly believe that hand hygiene is a powerful driver of progress across multiple development goals, whether this is improving from maternal health to the child health, to the nutrition, to the education, or strengthening public health emergency response. And we have been supporting government on integrated hand hygiene program in many countries. For example, integrating hygiene into national immunization program in Nepal, integrating hygiene into nutrition program in a couple of countries, similar to the maternal health, similar to the public health response. It might have been seen, without these guidelines, it might have been seen the niche of WaterAid to model integrated programming and focus on a strengthening system. But having these guidelines with a strong focus on integration and system strengthening, it certainly reconfirms the quality of the hand hygiene work that is undergoing, but at the same time, it helps strengthening more consistent and technical support to government in line with these guiding principles and standards that are included into this guide. Finally, Bruce, all actors into the sector, we have been promoting hand hygiene for decades, and universal importance of hand hygiene has been evident for many public health emergencies and beyond. But the great realization of importance of these global guidelines on hand hygiene after decades of implementation and dealing with so many outbreaks and pandemics, meaning we need to have more consistent, standard, guiding principle and process through which we design, implement effective hygiene program at a scale that will help achieving universal hand hygiene by 2030. And definitely our ongoing efforts on supporting countries will firmly benefit from these guidelines. And we appreciate the global efforts in developing these guidelines with the WHO, UNICEF, and all core partners, including WaterAid and others. And thank you, and over to you, Bruce.
Thanks, I'm smiling because I'm feeling very enthusiastic now, and also because all of you have, sort of inspired me. But I would like to have another round, but unfortunately we don't have time. And I realize this webinar is part of many, events in everyone's day that's online. So I'd just like to thank you, Natalie, Alex, and for your words. But more importantly, I think this partnership with governments is very important. It's what we're all working to do, and everyone on the call. So look forward to working with all of you. So that is our second panel. And with that, I'd like to turn this over to my colleague, Lindsay from UNICEF, who's busy dealing with everything in the background and in the foreground. So Lindsay, I even got it to you almost on time. So there you go.
And thank you, everyone, for joining us today. It has been such an interesting conversation. We've been looking at the overall understanding of the guidelines. We've had panelists from governments and panelists from partner organizations to talk to us about how we address the issues of hand hygiene in various settings. So we're going to have a chance here for some questions. I've seen questions in the Q&A section. Please go ahead and add more questions to the chat if you have them. And I'm going to bring up Jo to join me here so that she can also, sorry, just adding a spotlight, so she can also speak to some of the questions we have. So Jo, the first question that has come up a few times that I just want to, I think we can address in different angles is a question on settings. So there's been questions on whether informal settlements are included in these guidelines. There's a question on why not healthcare facilities. So maybe you could talk a little bit about how these guidelines address the various settings and how they're applied, and why we're looking at everything but healthcare facilities.
Sure. Thanks, Lindsay. I think I'll start with the last point there. So the reason we're looking at everything but healthcare facilities is because WHO has robust guidance on healthcare facilities and hand hygiene within healthcare facilities that exists and has been used for decades. So this was not a gap that we perceived during COVID-19 when we started to develop these guidelines. And you'll see in the guidance on page 2 that we're careful to illustrate how these guidelines compare to the guidance that exists on hand hygiene in healthcare facilities, so that any questions that might emerge for you if you work across the two types of settings hopefully will be answered on that page 2 of the guidance. The other question I think was around sort of the gamut of settings that we do cover. So I think I flashed a quick figure that illustrates this, that's also in the guidelines, and we're looking at 3 main sort of types of settings, looking at the household first, but then sort of moving outside of the household, any public spaces that you might move through or relax in or experience when you've left the household, and then also finishing in the 3rd type of settings, the institutional settings, where you might go shopping, or you might go and enjoy some food, or you might go to the workplace or a school setting. So all of those institutional settings are also covered by these guidelines. And it was something that we grappled with whilst thinking through how best to present this, because we want, of course, for the recommendations to be relevant to all these settings, whilst also highlighting any specific differences for a particular setting. So we were careful when we were formulating the recommendations in discussion with our guideline development group to make sure that the recommendations are applicable across these settings, and to highlight any situations or settings where a particular recommendation is or is not relevant. And you should see that highlighted throughout the guidelines. The fact is, the guidelines are global in nature, and so they are necessarily quite high level. And so really, these recommendations should be applicable across these settings, and only in very specific situations would they not be. What we want to do now in the next period is consult with communities of practice within specific settings of interest, so that we can help those communities of practice to engage with these guidelines and understand the extent to which they can adapt them to their setting and make them much more palpable. So there is an example in the guidelines on schools, actually. So, and this was actually developed by Lindsay, who's on the call, but really kind of taking these recommendations, these high-level recommendations, and applying them to a specific setting. We'll be doing that with all the settings that I've listed. You can have 1 or 2 pages for each of these settings that are very clear about how that applicability works.
Fantastic. Thank you, Jo. And I think that last piece of really being able to take this and start thinking about the implementation and how we move ahead with the guidelines is going to be really critical. So this is the first step. Consider this launch our first foray into how we approach these guidelines. And certainly there will be more to come, particularly looking at the various contexts. So there are a couple other questions here that are all coming back to advocacy. And so I'm going to actually turn to our broader panel. We've got our government colleagues on the call here. We also have our partners, GIZ, WaterAid, IFRC, as well as some UNICEF and WHO joining us for the panelists. And I'm curious that I'll call out individuals if I need to, but I welcome anyone to chime into this. How do we approach advocacy, given that these guidelines are directed towards governments? How do we support governments to utilize these guidelines? There was one question about the success in schools, but what about in other settings? How are we going to move that advocacy ahead? So I want to say, if any of my panelists would like to self-nominate and come forward, otherwise I'll call on someone. Alex, I see you've come, oh, maybe not. Been spotlighted, maybe perhaps accidentally. Anyone from the panel would like to speak? Perhaps, I could ask you to come in here and speak a little bit about advocacy from the great work that WaterAid has done. Do you have thoughts on how we approach more effective advocacy?
Absolutely. Thank you, Lindsay. I think, first of all, achieving universal hand hygiene by 2030 is the government commitment. I think we all need to be cognizant around this, and the government should have those. And then government has signed different international declaration, whether this is a universal access to wash in healthcare facility, global wash standards, for example, universal access to schools. Of course, every government has actually committed to achieving SDG 6. And we know hand hygiene is such a foundational and fundamental for achieving other health and non-health related development agenda. So I think what we need to make sure that our advocacy feature quite strongly that hand hygiene should be foundation and fundamental for every development discourse. And there has been evident, I think we need to be more vocal and confident on our language, how we talk with different actors. For example, in our advocacy language, for example, if you are going and start discussing with the Ministry of Education without hand hygiene in education settings, the school absenteeism is going to be high. It will compromise the quality of care, quality of education in school. Similar to the healthcare facilities, for example. So as we speak, in every 2 seconds, a mother gives a birth to a baby in a clinic where there is no hand washing facility. So how do we expect reducing hospital-acquired infections while we're fighting with antimicrobial resistance? Are we using this language when we talk hand hygiene with health ministries? Maybe not. I think using the right language with the ministry is quite identical and quite vital. And as we speak now, I think the recent estimates shows that if 46 least developed countries need to achieve universal hand hygiene by 2030, we need 13 to 15 billion investment. From where these investments are coming? Are we as the actors working in hand hygiene into the sector, are we using these evidence and facts with the ministries that we need more financing, we need more political champion into this on hand hygiene, right? So how do you actually influence national financing? Put hand hygiene part of the national development agenda is going to be vital. We need to feature that very strongly. But at the same time, how could we make sure that we leverage government existing financing through integration? I think one of this guideline is going to focus on integration. While hand hygiene is necessary for achieving undernutrition outcome, for example, the reducing and preventing infections, cholera outbreaks, future pandemics, antimicrobial resistance, maternal mortality, child health. How are we going to leverage the government existing financing? Are we doing the right advocacy and influencing with the respective ministry that the government themselves as actors and we as a technical partners actually collectively make those decisions for integrated programming? The more integration, the more leveraging that you can do in terms of bringing financing, but at the same time reaching wider population into the sector. So my last third around this would be, I think all of us are implementing projects in many cases, but we need to go beyond project-sized implementation of hand hygiene. We need to think big and act fast. We'll go for district-wide, nationwide campaign, because 2030 is just 5 years down the line. I think featuring these things in our advocacy agenda and language is absolutely fundamental. So what I'm saying, integration, system focus, advocate for financing more, we need more political champion. And finally, I think guideline talks about more integrated work on behavior-centric programming where we model, create proof of concept. I think we need to use those proof of concept more evidently to the sector in order to have wider buy-in and get a political attention. I hope I was fair a little bit in terms of highlighting where we need to focus on our advocacy. Thank you.
Fantastic. Thank you. And thank you for letting me put you on the spot. That sounded like a pre-crafted response, but I promise you all that was not. And I think that really highlights some of the major needs here in terms of, I think really your excellent point on integration, and it's been reiterated in the chat from Alex of IFRC about ensuring it's integrated into broader programs, whether that's health security, epidemic preparedness, climate adaptation. There are so many opportunities, but it's not a standalone pillar, hand hygiene. It's going to be part of all of these other efforts underway. I do, to further this, and I won't force anyone to come up on here, but I do think Bangladesh colleagues, you've made a couple of comments in the chat, both Mr. Rahman as well as Shafiqul, both of you saying, Mr. Rahman saying, please, WHO, UNICEF, bring this to the government. You can extend your cooperation to governments by translating the guidelines into action. And Shafiqul recognizing that hygiene is still a low priority and should be prioritized on the agenda, and that financing is highly needed. I just want to, with last moments here, do either of my Bangladesh colleagues want to make a final statement? I think you've made some really useful contributions today. Yes, please go ahead.
Yeah, thank you very much, Lindsay. Actually, many things has been spoken. Yeah, many things are spoken. It is true that it's a question of priority. Which one is first? Water, sanitation, or hygiene? Without water, we cannot expect the hygiene. So, government priority is not that up to catch the hygiene target, but for the community setting, actually, as we are talking, it's not household. In the household, we know the people are spending much on hygiene. It is about 60% of the total wash expenditure that is going for hygiene. But for the community setting, the government has to direct the implementing agencies, that those are the owner of the infrastructure, who has built this hand hygiene infrastructure in the public places. It will be their responsibility to provide liquid soap or soap, whatever is needed in the structure. That has to be a confirmed or mandatory activity by the government that the government can make. Only government can make that is a compulsory or mandatory. For the institution, those are actually responsible for the installation or construction of the infrastructure. I think if government takes it as a priority, then it will happen. Otherwise not. Thank you very much.
Thank you very much, Rahman, Mr. Rahman, and thank you so much for sharing the perspectives of the government and really being a champion of this issue. We so appreciate you coming in on an evening in Bangladesh to participate with us. With that, I'll go ahead and close our question and answer, because I think we have had quite the session this morning, and really going to thank you all for joining us on Global Handwashing Day for the launch of these guidelines. And I'd like to turn back to Bruce Gordon to give us the final remarks as we set the plane down here and send everyone off on a happy Global Handwashing Day. So Bruce, over to you.
Well, thanks, Lindsay. And I would also like to say, just in closing, that these guidelines are such a big an issue for WHO and UNICEF, and I'm closing on behalf of my director, who is just delayed on a plane now. But there's been a lot of excitement. So I think, first of all, UNICEF and WHO are very committed to supporting countries and partners. But I have to say, I just wanted to say, philosophically, it's not so much that the guidelines are there and it's for countries to adapt. I think there's many, governments and partners on the call that have been doing this for years. And so it's a question of using these guidelines to support your existing work and to make more of an impact on public health. And hopefully that will be a tool. You'll see, I think we had a bit of an issue with the link, but I think we sorted that out. And there's lots in the guidelines about implementation considerations and how to take it forward. So hopefully you'll have quite some reading material. I can only say that the guidelines were informed by just a tremendous amount of academic work looking at hundreds and thousands of studies through systematic reviews. But ultimately, the issue is, as everyone has said on the call, the panelists, and lots of comments in the chat about trying to take this forward, particularly at national level. So as far as concrete next steps, we really want to advance national level hand hygiene. So these champion countries and other countries that are interested in being early adopters, we'd love to work with you. We would love to document case studies of good practice, because I feel like the means of implementation are often, the most complex because of all the things we've talked about, different ministries, different coordination platforms, etc. There's the issue of these are settings, right? They're non-healthcare settings. I saw some, I think Claire was here with us from WHO, but these are not healthcare settings. And so the settings that we are dealing with are such things as schools, workplaces, public spaces, transport hubs, all these things that are happening at, the local level. So there's communities of practice that are already existing that deal with many of these settings. And we are very excited about working with these communities of practice to support communities in documenting also what they're doing and sharing lessons and adding to this evidence base. And there's also been, I think, Lindsay, you mentioned the issue of advocacy and calling out some comments from our colleagues on that. And that is going to be a continuous, I think, priority for us. And we heard our colleague from Bangladesh talk about government prioritization. And governments have lots to prioritize now, and it's a complex world we live in. But this is, I think all of us can agree, this is a kind of a no-brainer. Washing your hands, it's something we all know intuitively, and making sure that people have the means to wash their hands, soap, water, and that it's affordable and available. That's important and critical. So we have to advocate for that. So I think with that, that's where we intend to go. You'll hear more from us. I'd like to thank all of you. And of course, looking internally, the UNICEF and WHO teams for putting this together. This has been years of work, but the real meaningful stuff is yet to come. So thank you all for being with us, and have a wonderful rest of your day, and we'll be in touch. And with that, I'll close the webinar.